Okay. Hello, everyone. Assalamu alaikum. Good evening. Today, I've got a little workshop for you on natural remedies for babies. So, who don't know me yet, my name is Barbara. I am a midwife and lactation consultant. I've got over 20 years experience as a midwife. I am also infant feeding specialist with a training in holistic tongue-tie assessment. And I'm also classically trained homeopath and craniosacral therapist. Today, as I said, we're going to be talking about natural remedies for babies. We're going to be focusing on remedies for the most common ailments only, and mostly for babies from birth to about 6 months of age. And a little disclaimer, the presentation is for educational purposes only. The information presented here is not intended to replace the individualized attention of a qualified healthcare professional. Right. So the first thing I want to talk about is basically general health. What does it mean, and how do we start on the right foot, as you say? So the main steps from the very beginning, when the baby is born, so one of the very first steps is aiming for vaginal birth. Being born vaginal is really important for the baby, so that they get colonized by the right bacteria, they start establishing the right microbiome. But if we kind of skip that part, as in we look at babies from the birth, once they are born anyway, then the next main thing is skin-to-skin contact and breastfeeding. The skin-to-skin contact is really important to help them keep warm, settled, keep comfortable. It helps them regulate their heart rate, their breathing, their nervous system. And it encourages them to look for the breast and start breastfeeding. Skin to skin also helps with the microbiome, because obviously the baby is on you, on your body, on your skin. That way they get colonized by your bacteria and not by anybody else's bacteria. One thing I would say that is important when you're doing skin to skin is to have a blanket on top of the baby, yeah, because you don't want them to lose their heat to the environment. And then breastfeeding, obviously, in the first 2 to 4 days, you've got colostrum, which is really important for the baby in many ways. But there is one component, a special sugar that is in colostrum that actually is not designated for the baby as such, but it's for the gut bacteria. So there is sugar that feeds the right gut bacteria and helps with the microbiome. So that's really important to keep in mind as well. Then obviously general skin and cord care. So obviously in the first days, baby has still the umbilical cord stump that is clamped, and it's drying over the first few days, and then eventually it falls off. It's generally recommended to wait with the first bath after the cord falls off, because you don't want to necessarily wet it and make it damp and moist again. And also the skin needs a bit of time to transition from the water environment inside your womb to the dry environment earth side. So again, you want to give the skin a chance to do all the processes it needs to do before you bath it. And then once you start bathing the baby, just water. They don't need any soaps, any shampoos, nothing like that. Just warm water, and bathing just once a week is plenty. You don't need to bath them every day. That might be actually detrimental, because bathing too much may dry out the skin. You might know yourselves, or those of you who may be healthcare professionals, you know that we wash our hands frequently, and that dries our hands. So we also tend to use lots of hand creams to help our hands. So you don't want to do that for your baby. You want the skin to be able to regulate itself, so you don't want to bath it too often. In terms of immunity support microbiome, we already talked about the skin to skin, about the breastfeeding. And then also, yes, it's good to keep a clean environment around the baby. And if they are like bottle fed or something, you need to sterilize the equipment, things like that. But you don't want to overdo it. You don't need to sterilize everything. You don't need to sterilize all their toys and all those things, because actually sterilizing too much and preventing the kind of interaction with microbes and germs can also be a bit problematic for the immunity, because the immune system needs to be kind of trained, and they train by meeting these germs. If they don't meet them, then they won't be able to fight them off later on. And then again, we're not going to be talking about anything fancy here, anything laborious or anything expensive. We're going to be talking about things that you can find in your kitchen, about common herbs that you can buy as even as teas in any supermarket. We're going to be talking about some homeopathic remedies as well, but mostly those are going to be remedies that are available in the common home remedies kits. I'm going to be mentioning some essential oils as well that can be bought online, even in some health food shops, and so on. One more thing I wanted to mention is newborn rashes. A lot of when I was talking about the skin, as the skin has to adjust to the outside world, many babies do get a newborn rash. That might be traveling around the body. It might be on their back one day, on their tummy next day, on their legs the next day. And usually this is nothing to worry about. It's not pathological. You don't need to do anything about it. It just takes a few days and it will sort itself out. If you feel like it needs a bit of help, you can try to apply breast milk on it. But other than that, I would leave it alone, basically. Right. Next up, fevers. That's a big topic with babies or with children of any age, because obviously every child gets a fever here and there. So what to do about fevers? First of all, I wanted to say fever is an important immune mechanism. It's really important for the body to be able to have fever and use fever. So we can liken it to cooking. Not that you're gonna cook your baby, but when you're cooking your meat, for example, or anything, one of the reasons for cooking is to kill off pathologic bacteria, spores, germs like that, so that you don't get food poisoning from your food, for example, right? So the principle of fever is somewhat similar. So basically the body increases the heat to kind of deactivate the bacteria, the pathogens that might be causing illness. So from that perspective, it's really important to not suppress the fever harshly, quickly, necessarily, right? So again, for babies, your intervention number one, skin to skin. Yeah, so you know that you put the baby skin to skin after the birth to keep them warm, but skin to skin can also help them if they are too warm to reduce the temperature, because how it works is your body adjusts the temperature to either increase baby's temperature or decrease the baby's temperature. So if the baby is too hot, your body kind of cools down and takes on the heat from the baby, and that's how it helps them. And the other way around, if the baby is too cold, your body increases the temperature to heat the baby up. So that's kind of a good thing. So when you feel that the baby is under the weather, unwell, anything really, teething, whatever might be bothering them, and as well as fever, put them skin to skin. Not only it helps them regulate the temperature, but it also calms them down in general. I've got here the screenshot of the NICE guidelines advice for management of fever. So in terms of the antipyretic interventions, that means your ibuprofen, your Tylenol, paracetamol, Nurofen, all these baby syrups and stuff. As they say here, down at the bottom, they are supposed to be considered only in children who appear to be distressed with fever. Now, that's fair enough, but even before you reach to your paracetamol or ibuprofen, there are other ways how you can decrease the distress of your baby, and skin to skin is one of them, and perhaps one of the most efficient ones, right? Breastfeeding is another one. Even if you're not breastfeeding, you can still do skin to skin, and it can still help your baby settle and calm and be comforted. Breastfeeding, breast milk also supports the baby with antibodies from the mom. Obviously, it's fluids, so you need to keep them hydrated. That's a key. When they have fever, you need to keep them hydrated. So you need to make sure that they feed frequently enough. You could work with their layers, but at the same time, you want to make sure that they're warm. You don't want to take off their layers and they get cold, right? Also, in terms of sponging, you might have heard that it's good to sponge the baby with water. It has to be warm or tepid water, right? Not cold water, because if you put on that hot baby, if you put cold water, you might shock them, and that might actually lead to the convulsions, right? So that's that. You could use some apple cider ACV, apple cider vinegar in the water. You would use, so if you take like a bowl of water, you would put like maybe 2 tablespoons of apple cider vinegar in it. You could also use drop or 2 of some essential oils in that, together with the apple cider vinegar, because essential oils, as any oils, they don't mix with water. So if you want to add essential oils into water, you have to dilute them with something else, like with apple cider vinegar or salt or milk, or yeah, something like that. Good essential oils to think about: lavender, eucalyptus radiata. There are different types of eucalyptus oils. The radiata type is best one for babies because it's a bit gentler than other types of eucalyptus. Chamomile, either German or blue, or lemon essential oil. Now with the essential oils, if you have a complete newborn, perhaps avoid essential oils. I would wait with essential oils for until the baby is at least like 2 months old or something. On the very newborns, in the, let's say in the first 6 weeks, I would use essential oils very sparingly, very carefully, because obviously their skin is very, very sensitive, and always dilute it in a base oil. At the end of the presentation, I will have a slide explaining how you dilute the essential oils, how you can use them, and the different ratios. So that's that. And then some homeopathic remedies that you can use for fever. So aconite is one of your first ones. That is Usually you would use aconite at the beginning of any illness, like if it's a cold, cough, fever. It's a good remedy for, as you say, tipping it in the bath. So yeah, so you use it at the beginning of the illness. In terms of fever, the fever is coming on suddenly, and often after exposure to cold air. If you take them outside in winter and then you come back home and all of a sudden they have fever, or also after fright. So I don't know, maybe could be the typical example could be after vaccination. Yeah, they get vaccines. It's painful, scary for them, and after that they spike a fever. They can have, with the fever, they can have racing heart rate as well if you manage to check somehow. They might be very restless. You might also notice that they're alternating between feeling hot and feeling chilly, or like even like, trembling, shaking from the chills. Yeah, I think that's enough about aconite. Belladonna is another great one for fevers. What is typical for belladonna is that the fevers are really, really high, and the baby would look red, like flushed, and would feel really hot to touch. So red, hot, high fever. Those are the main signs for belladonna, and also very rapid onset. They might have like glistening eyes, glistening cheeks, because they're so hot that they almost like glisten, they're burning hot. But if you touch their feet and or their hands, they might feel really cold. Glazed eyes. They might have dilated pupils in the eyes. They can be quite angry, screaming. Yeah, they might even look like in a bit older babies, older children, they might be a bit delirious as well. And also usually it's worse in the afternoon, like from 3 p.m. to 3 a.m. over the night. They might have, you wouldn't know in the baby because they won't be able to tell you, but older children might tell you that they have throbbing pains, like throbbing headache, for example. Bryonia is another good one for fevers. This one is for fevers that are more gradual. Yeah, the temperature is raising more gradually. And you can notice that the baby feels better, feels more comfortable when you lie them down, rather than if you move them, if you lift them up, if you try to interact with them. They might have, bryonia is for dryness as well, so they might have dry lips, dry tongue. They might also be constipated. They might be irritable, and they might actually be calmer when you put them down and let them rest, rather than when you want to cuddle them. They, like, if it's older child, they would even tell you that they want to be left alone. Baby won't tell you, but you might notice it when you're like handling them. Another thing to talk about is about how you check the temperature. It's always good to have a thermometer at home. Personally, I am a bit old-fashioned, and I prefer the old mercury thermometer. So I still have that one at home, and I always use that one with my kids and myself. I also have this one mostly for work when I'm seeing babies. But this is a good thing as well. It's just is much quicker than the mercury one. So yeah, it's a good one as well. And you definitely want to check the temperature under the arm, right? You just want to make sure that the tip doesn't stick out. If you put it under the arm, you don't want it to stick out on the other side from the armpit. You can't really use this in the mouth with a baby. It's not gonna work. They won't hold the mouth closed just because you put something in there necessarily, especially if it's like upset crying baby. You can get the skin thermometers like to use on the forehead or on the chest. They're not as accurate from my experience. And the ear ones also are not very accurate, especially for newborns. Plus, you would have to be very careful not to hurt their little ears. So this is probably the best way of measuring temperature for your baby. Now, some red flags or when to seek help if your baby has a fever. So obviously for newborns, you have to be a little bit more careful in terms of how high the temperature is. So maybe we should also say what is normal. So normal temperature is between 36.5 to 37.5 Celsius. I'm not sure what it is in Fahrenheit, so please Google it. If you have a complete newborn and you're getting to like 38, 38.5, in the UK, at least call 111 or call your GP and check with them. But with newborn, you need to be a bit more careful and have like lower threshold for getting the baby checked by a doctor, even going to A&E with them. Obviously, the older the child is, the, let's say, more lenient you can be, but you also have to watch the whole picture, right? Is your baby reasonably active? Obviously, if they have fever and they are unwell, they will be a little bit, they won't be as hyper as active as if they are well. But are they responding? Are they communicating? You know, do they have a bit of energy in them, or are they floppy, right? Another thing is if your child has a history or signs of convulsions, then do take them to the hospital. If you have any other concerns, or if you have concerns at all as a parent, you know your child best. So you need to also listen to your instinct. If your instinct telling you this is not right, I need to take the child in regardless of the temperature, even if it's like low-grade fever. Or if you've used all these different home options and nothing is working, the temperature is not responding, then you might want to see a doctor and get the baby checked. Right, next up, big one as well, jaundice. So jaundice is very common in newborns. Most newborns get jaundice, regardless of anything. Whether you give them vitamin K injection or drops or anything, whether they had any other medication, whether they had vaginal birth or a little bit more traumatic birth or something, they can still get jaundice. And that's because when they are in your uterus, in the womb, they have they have bigger red blood cells with a higher density of hemoglobin. They have, it's called fetal red blood cells, or fetal hemoglobin. When they are, because obviously there is less oxygen in the blood they're getting through placenta than what we have, because we're breathing, right? So we carry, our red blood cells carry much more oxygen. So their red blood cells need to be able to catch more oxygen, to pack it a bit more, to utilize whatever is there, right? And then when they're born and they start breathing, their fetal red blood cells have to gradually change into what is referred to as adult red blood cells, or, you know, normal red blood cells, if you like. And that transition means that there is more bilirubin, because when the hemoglobin breaks down, when the red blood cells die and the hemoglobin breaks down, it breaks down into different particles, and one of those products is bilirubin. And the bilirubin, it happens in everybody, right? It happens every day because red blood cells don't have that long lifespan. The fetal ones live about 80 days and the adult ones about 120 days, right? And it's a gradual process. Every day we've got some red blood cells that die and red blood cells that are born, if you like. So that happens every day. So every day our bodies are dealing with bilirubin, and it's excreted by the liver into the gut, and then it's effectively what gives color to our pee and poo. So we poop it out basically. But in newborns, again, the liver is not quite mature yet, so it might not cope as well with the extra load of the bilirubin that they have. So that's why the excess bilirubin is then accumulating in the skin and maybe in other parts of the body, and that's causing the jaundice that gives the yellow color to the skin. Jaundice also has a process. So usually the white parts of the eyes are the first that go yellow, the mucous membranes in the mouth, then the face, and then it travels down the body, and it recovers in reverse. So the eyes are usually the last that clear out. So what I just described is pretty much physiological jaundice. That's jaundice that most babies get regardless, right? It usually starts appearing on day 2 or 3, and usually resolves within 1 to 2 weeks after the birth. There's no need to do anything about it, you just watch the baby. Then there is something that is referred to as breastfeeding jaundice, and that is related to how the baby feeds, right? So if the baby is not getting enough milk, they might effectively become dehydrated, and that slows the bilirubin elimination. So they might be a bit more jaundiced, right? Then there is breast milk jaundice, which is slightly different. Breast milk jaundice usually starts a little bit later, maybe like after the first sort of 5 days or so, because the baby needs to be first exposed to breast milk. And usually, if everything is fine, it takes 2 to 4 days for colostrum to transition to full milk. And that's because, and the jaundice associated with breast milk happens because there are some substances in the breast milk that can temporarily slow down the bilirubin metabolism, right? It's only temporary, temporary in the sense of that it might take few weeks for the jaundice to resolve, but again, it usually resolves by itself and is harmless and doesn't need any treatment. Now, these other 3 types of jaundice are what is generally referred to as pathological jaundice, and these usually require treatment with phototherapy. Hemolytic jaundice results from basically incompatibility between mom's blood type and baby's blood type, and that could be, for example, if mom is RhD negative and baby is positive. It could be also incompatibility in terms of the ABO blood group system, and there is also something that is called G6PD deficiency. We don't need to go to details here, but basically these conditions cause more rapid breakdown of the red blood cells. That means more bilirubin and more work for the liver, and more effort to kind of excrete it, and the baby usually needs help with it. Then premature babies, just because they're premature, their liver is even more premature and has more trouble processing the bilirubin, so they can get more jaundice. And then some babies, it's quite rare, but it can happen that they are born with some liver conditions and metabolic disorders that can affect bilirubin processing. Right, so that's that. Now, what to do about jaundice? So, as I mentioned, breastfeeding, feeding is one of the main interventions. You need to make sure that the baby is getting enough fluids, meaning enough milk, to help them basically flush out the bilirubin, eliminate it out of their system, right? Another sort of traditional intervention is exposing the baby to sun or daylight. You just need to be careful that you don't burn the baby with the sun, or that they don't get cold if you're exposing them, taking the layers off. You don't have to take everything off. You can keep them like wrapped up, just keep their face exposed to sun or daylight. But again, make sure they don't get cold and they don't get sunburn. And it doesn't have to be long. So obviously, at this time of the year, there's not much sunshine, but at least, you know, a little bit of daylight could help. And if it's in the summer, you definitely don't want to expose them to the sun in the middle of the day when the sun is the strongest. Chamomile tea, a very good thing for liver support, for gut support, kidney support. It says mother here because it's the mother who should be drinking chamomile tea, and through the breast milk that can help the baby. Chelidonium is a homeopathic remedy that is very good for liver support. So that might be a possibility, but I would, in terms of jaundice, I would definitely suggest that you speak to a homeopath, that you don't try to treat it by yourself. And when to seek help, if your baby is really, really yellow all over their body, right? So not just the eyes or just the face, all over the body, very yellow, more sleepy than usual, not waking up for feeding by themselves. You have to wake them up, and it's not easy to wake them up. Not feeding well, like not sucking strongly, you know, quite weak. If they're floppy, lethargic, anything like that, take them to the hospital and get them checked to make sure whether they need or don't need extra help with the jaundice. Right. Nappy rash, next one, also very common one. Most babies, if not all, get a nappy rash once in a while. So step number one, air. Take the nappies off, clean the baby with water or with essential oils water. I'm gonna mention it in a bit. And then air them, air the bum so that, you know, it can dry and it can just get a bit of a relief. Nappies, not just take them off and air the baby, but sometimes it's also about considering trying different brand of nappies, because we all know that obviously the nappy producers use various chemicals to bleach the nappies and whatnot. And the residues of these chemicals from the manufacturing process can be causing irritation to the skin. So sometimes it's worth a try. Different brand of nappies, maybe try to go for some bit more ecological nappies or like sensitive brands, or even trying reusable cloth nappies might be a really good idea. In terms of nappy creams, important thing in terms of a nappy cream is not to use it all the time. Yeah, you're not meant to use nappy cream every time you change the nappy, because that way you're kind of creating a resistance in the skin, and then it will kind of stop working and the baby will get a rash, and then what you're gonna use then, right? So you should use the nappy cream only when you need it, when the baby actually does have a nappy rash, and then it can work quite quickly, just few applications. Another thing, try to avoid nappy creams based on mineral oil, because that just clogs up the skin, right? You need something that is at the same time breathable. Always aim for something as natural as possible. When you buy any skin products for your baby, even for yourself, always read the labels with the ingredients in it, and try to use things that have the least amount of chemicals, that are as natural as possible. Calendula or marigold is amazing herb for all things skin-wise, healing skin. And there are some nappy creams out there that contain calendula or are based on calendula, or you can buy just calendula oil and use just that on your baby's bum if they need it. Calendula is also antifungal, antimicrobial. So even if the nappy rash gets a bit infected, it can help quite nicely. Another thing that you can consider is honey. Probably better not to use it if you have that type of nappy rash that blisters and the blisters burst and you have like raw skin, raw wounds there. But if the skin is not broken, you can use honey as well. Again, try to use some good quality honey, or you can even use breast milk. Breast milk is an amazing fluid, not only nutritionally and in many other ways for the baby taking it in, because we said that breast milk contains lots of antibodies and antimicrobial properties, enzymes, and all these things, vitamins and everything. It can also be used on skin, like if they have all these skin rashes or nappy rash or cradle cap. We're gonna talk about cradle cap maybe next. Or anything like that, or even if their umbilical cord is a bit smelly and looks like it might be a bit gunky, infected or something, you can try to clean it with breast milk. If they have sticky eyes, you can clean it with breast milk. If they have a bunked nose, you can use breast milk as nose drops. So yeah, it's amazing fluid that can be used in many ways. Again, some essential oils. For a newborn, I would use it more as a hydrolat or as a essential oil water. Hydrolat you can buy. So wherever you buy your essential oils, they would usually sell hydrolats as well. Or you can make your own essential oil water. As I said, there will be a slide at the end which tells you how to prepare essential oil water. For older children, after those first 6 weeks or so, you can use essential oils with base oil instead of like a nappy cream, for example. Colloidal silver is another useful thing that you can use. It's antimicrobial, so you can just spray it on your baby's bum, let it air dry before you put a nappy on. And in terms of homeopathic remedies, here are some suggestions. So graphitis is for nappy rash that looks that is more on the dry side, and the skin may look red, scaly, can be cracked, and can be itchy. And if there is a discharge from the cracks or whatever nappy rash, the discharge would be sticky and it will create like crusts on the bum. Cantaris is good for nappy rash that looks beefy, red, scaly, almost like scalded. Cantaris is also a remedy for burns. So, you know, if you imagine what a burn, I'm talking about like first degree burn, not second degree with blisters and stuff, more like first degree burn, you know, that red, like scalded skin. So that's what the nappy rash would look like. It would be red hot. There could be some blisters as well, and it would be worse. The baby would be probably screaming at you if you are cleaning them with cold water, right? So for baby with this type of rash, you will want to use warm water to clean them. I mean, it's generally better to have warm water, right? You probably wouldn't want to have cold water poured on your privates anyways. It's not pleasant. So warm water is generally nicer anyway. Now, silica is for nappy rashes that tend to get easily infected. It might have discharge with like a pungent pus, and the baby might be like trembling, you know, almost as if they're getting like fever from that nappy rash and they are trembling, right? Sulfur is another good one for rashes in general. The rashes that respond well to sulfur may look also red, hot, dry. They would be itchy. With sulfur, there is a great itchiness. In terms of nappy rash, it would be more around the anus, around the bum, than in the front. And for this baby, it would be worse if you bath them in warm water. So actually for sulfur baby, they might prefer if you clean them this time because they have the rash with a little bit cooler water. But generally they don't like bathing. Sulfur babies don't like bathing. And they also would be more uncomfortable at night in the warmth of the bed. Right, so that's the nappy rash. Now, cradle cap. Yeah, that's another frequent one. A lot of babies to get cradle cap, not all of them to this sort of level, but many babies do get a bit of the yellowy crusts. Sometimes it goes down to forehead and eyebrows, sometimes on the ears or behind the ears, sometimes even behind the neck. It's caused by basically the sebaceous glands that are not balanced yet. So again, if you don't do anything about it, sooner or later it should fix itself as the sebaceous glands get more mature and are kind of balanced. But you know, if it's to this extent, then you might want to try to do something about it. I'm saying try to do something about it because it's not always successful and it tends to come back basically until the glands are capable of managing the production of the sebum. So things that you can try are like chamomile tea. Again, you as a mother can drink it and it can help the baby through the breast milk, or you can use it as a wash. Similarly, also rosemary tea as a wash. So you would make a cup of tea, chamomile or rosemary, you can put both of them in one cup. And then you can either use that tea as it is, or you can just put it in a bigger bowl with water and like dilute it a little bit down, and then just wash the head, the scalp with that. Again, as we said, breast milk, you can use breast milk to soften the crusts. The most, let's say, popular or reliable way is using oil and wash. So basically you would use some oil, like almond oil, jojoba oil, shea butter, chamomile, coconut oil, olive oil even. Basically some plain plant-based oil. You would put it on the affected areas. The purpose of the oil is that it soaks into the crusts and makes it softer and easier to wipe off. And then you wipe it off with a muslin, or you can use that soft baby brush, and then you wash it off. Don't try to pick the crusts like this with your fingers, because you can make it bleed, right? And even if you're using the oil method, if you see that it's bleeding somewhere, stop or avoid that area. Don't try to push it, right? Again, some essential oils that you can add into the base oil when you're kind of applying it on the head: lavender, lemon, tea tree. Tea tree, well, pretty much all of these oils are antimicrobial and antifungal. So sometimes, especially if the crusts are pretty thick, like on this picture, it may get infected, bit of fungal infection there. So these oils might help combat it. Also, the calendula oil that we talked about in the Nepiresh is really nice for that as well. In terms of homeopathic remedies, I've mentioned these three there. Kalk carb is good for cradle cap where the baby has a really sweaty head and the sweat would be sour smelling. The scabs would be quite thick and they might actually bleed when you're picking them up. So this baby on the picture might actually benefit from kalk carb. It can also spread in kalk carb. It can be spreading, the cradle cap might be spreading to the face and it will be yellow or white in color. Graphitis is another one. In graphitis, the scales also can be spreading to the eyelids, but also behind the ears. In graphitis, it's easier to wash it off or do that oil and wash method, and it will come off quite easily, but it will come back. And the scalp might be cold to touch. Thuya is good where the cradle cap spreads on the other side to the neck or to the ears. The head might be also sweaty, but in this case, the sweat will be more sweet smelling, like honey kind of thing, right? And also Thuya is good for cradle cap that has the fungal infection or develops as a result of fungal infection, or for example, after vaccination or something like that. Right. Next up, constipation, another big one for babies. First intervention when your newborn or young baby is constipated is review feeding, right? In most cases of newborn constipation or baby constipation in general, even babies that are on solids, the reason for constipation is feeding, that they're not getting enough milk, or they are on formula and the formula is constipating them, or when they're older and they are having solids, they're having too much or not the right solids at that stage, or both, too much and not the right solids, basically. So it's most of the time constipation is linked to feeding or eating. There could be other things going on, like the baby's microbiome might need a bit of help because maybe they were exposed to antibiotics in pregnancy or during birth or after the birth, or maybe they were born by C-section and that's how their microbiome got impacted a little bit. So you kind of need to look at the whole picture. So feeding, and is there any other things that could have contributed to it? In terms of bottle feeding, it's good to, let's take it step by step. So first of all, breastfeeding, mom's diet is also important. No, first of all, there could be something that you're eating that is causing constipation to your baby, but it could also be that you are constipated. So if you're constipated yourself, it can actually be causing constipation to the baby as well. Don't ask me for details how that works. It just works. So make sure that you are not constipated yourself. Make sure that you eat well, keep hydrated, and all that, right? And then if you are not constipated, then kind of think about whether there is something the baby might be reacting to. And then if the baby is bottle fed, you could try different formulas. Sometimes the babies do better on goat's milk based formulas or organic formulas or whatever. Basically, stage 1 formulas are very similar in terms of what is in them, because there are very strict regulations for stage 1 formulas. But some components might vary, like the goat's milk base, soy milk base, cow's milk base. So, for different babies work different things. So you can try that. Also, it's about how you feed your baby. So look up paced bottle feeding, because that one, it helps the baby to be a little bit more in charge of what they take in. That prevents overfeeding, and that can prevent constipation, right? However, they might be constipated also because they're not getting enough formula. So think about that. Is your baby getting enough formula actually? Is the formula correctly prepared with the right proportion of the powder and the milk, right? Sometimes it's also about ready-made formula and powdered formula. Sometimes babies get easier constipated on the powdered and do better with ready-made, or the other way around. So those are also things you need to think about. If you're not preparing the formula and somebody else is doing it for you, are they putting enough water in it, the right amount? Are they putting the right amount of the powder in it, or are they putting too much or too little, right? So all that. And then the way you're feeding the baby. And also it could be the teeth. Well, you should always stick to the slowest flow teeth anyway, but this is more about latex versus silicone. So the clear rubbery teeth are made from silicone, whereas the yellow ones are latex. The latex ones seem to be softer than the silicone ones. And this is something that I learned from one very experienced midwife many years ago, when I was supporting a family with a baby who was constantly constipated. And we tried all sorts of things, including probiotics, everything. That baby was bottle fed. We tried different formulas. We tried ready-made, we tried powdered, we tried goat's milk, we tried cow's milk, we tried organic, everything, and nothing would work. And then this midwife told me, try a latex teeth. I'm not sure how it works or what's the rationale behind it, but because the latex teeth is softer, maybe somehow the babies eat better from it. And basically that was the trick. The baby did much better with the latex teeth than the silicone teeth. So that's something to consider as well. Another thing that I didn't actually put in this slide is it might be worth, it could go somewhere here around the tummy time, tummy massage, helping the baby move the gut a little bit. it might be worth seeing a craniosacral therapist or osteopath, especially if the baby had a bit of traumatic birth, because there could be something, some misalignment in their body, some tension somewhere that could be impacting their bowel movements, and could be contributing to the constipation. So another thing to kind of think about. Other than that, all sorts of the bicycle legs and everything, tummy time, tummy massage, things like that. Again, for babies that are older than 6 weeks or so, you can consider using a bit of essential oil in the massage, again, diluted in the base oil. So mandarin, lemon, grapefruit, all these citrus essential oils are quite good for digestion and bowel movements and things. Lavender is, I would say lavender is like universal all over oil. It's good for everything pretty much. So if you want to use essential oil and you're not quite sure which one, you will never go wrong with lavender. Probiotics, as I mentioned, it could be a consideration if your baby was exposed to antibiotics or if they had cesarean birth or something like that, just to help them sort of boost the gut microbiome, or if they can't be breastfed, it might be a good idea, because breast milk is probiotic in itself, but obviously formula doesn't have probiotic cultures in it. So it might be worth to try adding some probiotics into their diet as well. Again, chamomile or fennel tea for mom to drink. Both help with anything gut related, digestion, gut discomfort, things like that. They also support milk supply, by the way. But I'm saying support, they're not going to increase your milk supply just by themselves, right? Warm bath, that might be a good thing to try as well, because when you dip the baby into the warm water, they relax, their tummy relaxes, and they kind of let go. So that might work as well. Just be prepared that there might be poop in the water. And in terms of the homeopathic remedies, again, we've got bryonia. We already talked about bryonia before. So one of the key symptoms of bryonia is dryness. So even the poop would be quite dry and painful to pass. But when they finally pass it, there will be quite a lot of it. They might also have dry mouth and tongue, and they could be quite irritable. With nux vomica, the baby will be passing little bits frequently. Yeah, so in every nappy you will find a little bit, but not a full poop. Again, the baby will be quite irritable. It could be quite painful for them to poop. So you would see, if you see them pooping, they would be quite irritable and uncomfortable and might be crying. And nux vomica is also good for babies who've been given lots of laxatives to help them poop. So nux vomica might work for them as well. Now silica, that's the poop that is coming and going, coming and going, coming and going. And it's more because as if the baby doesn't have enough strength to poop, right? They just look like they are trying, but they don't have enough power to poop it out. And they also can have the fissures and cuts around their bum. I've got opium here. So bryonia, nux vomica, and silica are usually in the kids. Opium and alumina are not. Usually alumina might be in some, but opium you would not find in regular home remedy kit. But it is a good remedy, or could be a good remedy, especially if the baby had like traumatic birth with lots of drugs, like, a C-section, for example. Not that the baby gets the drugs, the mom gets the drugs, but the baby is still affected by it, right? Because through mom, they get the drugs as well. And alumina is Good especially for babies that have constipation because of formula. There is that link with aluminium because formulas can have some levels of aluminium, or if they have constipation after vaccination, again, that's the aluminium link. And they might be straining a lot, but if they poop, the poop will be actually soft. Right, so that's constipation. Now, coughs and colds. Newborns don't often get coughs and colds, especially if they are breastfed, because they tend to be protected by the breast milk. So it's more maybe a bit older babies. But again, any baby can get cough or cold. And as we said, your first line of intervention or treatment is skin to skin. Yeah, you are making them comfortable, they're settling, they're not so stressed, because obviously it's stressful for them if they're not feeling well, if they're coughing, so they need a bit of help in that respect to relax them as well. And that in itself might help them calm the coughing. Plus, skin to skin helps them regulate their breathing, their heart rate, and overall regulation. Vitamin D is very important. And at least in the UK, it's recommended to give vitamin D to supplement all babies from birth. If you are formula feeding, you don't have to give them extra vitamin D once they take at least 500 milliliters of formula a day, because that would be already fortified enough. And vitamin D is very important for immunity, being able to fight off illnesses. It's important for skin health, gut health, nervous system, obviously bones and teeth and everything else. Breastfeeding, another important thing, because again, you are helping the baby with your antibodies. When the baby is breastfeeding, they are like, their saliva is communicating with your body. There are those chemical transmitters, or however you pronounce that word, that communicate with your body and inform your brain that the baby is unwell and what they need. And then your body makes sure that it sends through the breast milk the right antibodies and whatever the baby needs, right? So that's really important. You can help your baby that way. Plus, obviously, the probiotic aspect helps the right gut bacteria, and that increases our immunity. Also, it helps to soothe, for example, the throat. If they're coughing, the throat would be sore. So drinking the breast milk might help sort of soothe it. And overall, breastfeeding is calming for them, that sucking and all that. And they're close to you, the warmth and, all those emotions. Somebody's looking after me, that kind of thing. And keeping the baby warm. So again, that's the skin to skin, or otherwise, if you have to go out, if you have to go and see the doctor, for example, make sure that you dress them up properly, put a hat on them so that they don't get cold, right? Or even more than they already are. In terms of essential oils, these ones are quite good for any respiratory issues, and you can use it in many ways. So you can use it in like a chest rub, or like massage on their feet, or chest on their back, or just rub into their hands or something. You can use it for a bit older babies, not newborns, in like a little steam. So basically you will fill up your bathtub with hot water and put a few drops of essential oil in it. That will steam up the bathroom, and then you sit there for a few minutes with your little one. Or you can use it in a little diffuser in the room where the baby is. If you're diffusing, maximum 30 minutes in one go. And you have to keep an eye on that baby, yeah, so that they don't have some coughing fit because of the essential oils, right? So same as you would do a patch test on the skin, you have, before you apply the essential oils on a bigger area or before you do a massage, same, you have to be careful when you're doing the diffusing or steaming. You have to do like bit by bit, just go in for a minute or two, get out, see how the baby is. If they tolerate it, if they're fine, you can do longer, right? Or you can use it in a bath. For coughs and colds, you need to be really careful so that the baby doesn't get even more cold, right? So really warm water. You don't want to scald the baby at the same time though. And when you take them out of the bath, you have to make sure that the bathroom is really warm and that you wrap them up, dry them really quickly and really well, okay? And again, some homeopathic remedies. We already talked about aconite, that it's really good for the onset of the illness. Usually they would get cough or cold after exposure to cold air, like you go out, you go to a doctor or something, you go to see a midwife, you come home, baby starts coughing, right? The cough with aconite would be like dry, croupy, kind of seal-like barking, yeah? And again, as we said before, there will be the restlessness, they can have dry mouth, they will be, the cough will be worse in cold, so if you open the window or if you take them outside, it might be worse. And it might be worse around midnight or after midnight at night as well. Bryonia, we already talked about bryonia as well. So again, dry cough, more hacking. And usually it starts with runny nose that moves then lower to the chest. And as we said before, babies who need bryonia are worse by motion. So you would notice that maybe they cough a bit less when you let them lie down and rest, but once you pick them up or try to take them somewhere, they start coughing more. And they might cough a bit more in like hot, stuffy rooms as well. Antimonium tartaricum is for wet cough. So you can hear the rattling in the chest. You can hear the mucus there, but they can't bring up much of it, like as if it's stuck there, right? So, yeah, there is lots of rattling, but not much is coming out. And this baby, because of that mucus, will feel better if you actually hold them upright rather than when you put them down. And Drosera is another one for more dry cough. That's type of cough where the baby coughs non-stop, right? It's the typical one for whooping cough, right? But it doesn't necessarily have to have that whoop at the end. So it's continuous dry cough with the barking or whooping. This baby will also cough more when you lie them down. Or for older children, parents often say that they start coughing the minute their head touches the pillow in the evening when they go to sleep. So they might be fine the whole day, and in the evening, the minute they lie in their bed, they start coughing. And they might cough to the point of retching and even vomiting. And pulsatilla is another one for wet cough with mucus. In this instance, you will see mucus, and it will most likely be yellowy green, quite thick. Pulsatilla is generally good for illnesses with yellowy green discharges. Interesting thing with pulsatilla is that the baby would be quite bunged up at home or indoors, but the minute you go outside, the nose starts running, yeah? And often pulsatilla babies are quite miserable, quite weepy, more like needy, clingy. They want to be carried all the time. They want lots of attention. You can't put them down. Not that they would start coughing when you put them down, but they would start crying because they want to be cuddled. They want that attention that makes them feel better. Right. That's coughs. Colic and reflux. Right. So that's the last ailments we're going to be talking about today. And I purposely left colic and reflux at the end because it's a big thing. It's a big issue, especially in my world, in my work with babies and children. Colic and reflux are not illnesses, are not diagnoses in themselves. They are symptoms. They're symptoms that something else is happening. Something else is causing colic and reflux in the baby. And most often, it's feeding, latch issues. Yeah, the baby is probably not latching on well, taking in too much air, that is then sitting in the tummy and causing colic or reflux. Another reason could be a tension somewhere in the body, typically around the neck, in the jaws, under the tongue, restricting the tongue movement. It could be a tension in the diaphragm, somewhere along the spine. And that tension could be due to position in the uterus. It could be, and often the reason is birth, like if the birth is a bit traumatic, too fast, too slow, difficult, C-section, something like that, forceps, vacuum, this type of thing. It could be also associated with tongue tie, or it could be the other way around, that the tongue is restricted because of the tension, because of the birth or something, rather than tongue tie in itself. Sometimes there are food sensitivities that could be a contributing factor. So from that perspective, if your baby has colic or reflux, first of all, do see a lactation consultant to assess the latch and make sure that there is no issue with the latch. Ideally, you want to see a lactation consultant that is also a tongue tie practitioner, that they can assess adequately the function of the tongue, whether there is a tongue tie or not, right? Another professional you want to see is craniosacral therapist or osteopath to assess the tensions, the misalignments, the birth traumas and all that in the body, and help the baby fix it, right? If you see someone like myself, I can do all of that in one go, right? Because that's how I work. I see the baby as a whole. So I assess their feeding, I assess their tongue function, and because I'm craniosacral therapist, I assess their whole body, whether there are any tensions, misalignments, blockages, anything like that. And then we can move from there and work on whatever needs to be worked on to help them relieve the colic or reflux. Another thing, we already talked about the fennel and chamomile tea. Again, great for anything gut related, so it can help resolve this. And again, mother is drinking these teas, and through the breast milk, it can help to the baby. In terms of the food sensitivities, it's good to have a food diary. That means that you write everything that you eat and drink and baby's symptoms. You would need to do this for at least like a week or two so that you can start noticing a pattern, if there is any pattern. And you also have to be mindful to read labels. If you buy any like sauces or ready-made meals or anything like that, or if you eat out or something, you need to read or check all the ingredients for hidden things like hidden dairy, hidden sugar, hidden wheat and gluten, what spices are in there, things like that. Because it can be something in it. You could be using like a pasta sauce or something, and it could be that it has, I don't know, yeah, typically it has tomatoes, so it could be tomatoes in it, but a lot of these sauces contain extra sugar, contain dairy that you might not see when you're just looking at the sauce because it's all red from the tomatoes, but it could still have some dairy. Also, if you eat something like crisps, obviously that's not ideal when you're breastfeeding. It's not ideal for anyone, but you know, we're just people and it's just good. So we all have some crisps here and there, right? But do check sometimes what is in those crisps, and you would be surprised that it has milk in it, right? That you would not expect your crisps to have milk. So you know, things like that. So just be mindful of that and write everything down and see. And if you do see a trend that the baby is reacting to dairy or beans or something or spices, then try to avoid those things from your diet for another few weeks. Usually, if you're doing elimination diet, it's recommended to do it for like 4 to 6 weeks so that there is enough time for any traces of that food to leave your system, baby's system, and then see how they are, right? So yeah, and then you can compare whether the baby is any better or not. And then obviously all these things like burping, tummy massage, warm bath, you know, to help the baby relieve that. Again, probiotics, that might be a good idea, again, if the baby was exposed to formula, antibiotics or C-section, anything like that that could have impacted their microbiome. Probiotics might help relieve the symptoms of colic and reflux. Essential oils, again, for babies after sort of 6 weeks, for like the tummy massage, for example, in the bath or something like that. Or herbs that mom can have in her tea. You can have one of these, or you can have all of these, a combination. There are actually quite nice breastfeeding teas out there on the market that would have various combinations of these herbs and spices, and some others. Sometimes they have nettle in it, even the raspberry leaf tea, and many other things. So you might as well get a good breastfeeding tea that could help with all these things, with colicky reflexes symptoms, with constipation. It can support your milk supply and all these things, you know, and generally it's quite nice. They taste quite nice. And it can help you at the end of the day as well if you have a bit of constipation, bit of bloating, stuff like that. A lot of women do after a birth anyway. So yeah, it might be quite nice. Plus, it supports your hydration as well. And then in terms of the homeopathic remedies that you can try for colic and reflux, remember all these like herbs, essential oils, homeopathic remedies, they can help relieve the symptoms temporarily there and then, right? But if you don't fix the underlying cause, this will not help. It will be, the symptoms will be coming back, right? It's like if you're treating eczema with topical creams on the skin, that will not treat the eczema. The cream will soothe the skin there and there temporarily, but if you don't address the root cause of the eczema, it will be coming back, right? So that's similar. So the homeopathic remedies can be really effective in relieving the colic and reflux, especially if it's something like food sensitivities, or if it's something related to microbiome or the formula or something like that. The homeopathic remedies can be quite effective. But if the issue is poor latch, poor feeding, you can't fix latch with a homeopathic remedy or with a herb or something like that. I hope it makes sense. So chamomilla, many parents know chamomilla for teething. And yes, it can be a great one for teething, but similarly, it can help relieve the symptoms of colic and reflux. And the baby that needs chamomilla will be quite angry, irritable, screaming, so that screaming babies. They might have green stools, right? And they simply just want to be carried all the time and rocked and jiggled, that like movement all the time. They can't be still, and you can't put them down. And generally they are worse in the evenings. Lycopodium is a good one, where the baby has distended tummy. You can see that the tummy is so bloated, there's so much wind. You might even hear like gargling sounds in the tummy from the extra air that is there. When you put the baby down, they might be rolling from side to side to try to dislodge the air and like escape it. And actually, when they pass the wind, they will settle for a bit, right? Until they feed again and get more air in. And that's exactly what you would also hear when they're feeding. You would hear that gulping, that they're taking not just the milk, but they're gulping the air in on the breast or on the bottle. Calc carb is good for refluxy babies, well-fed babies that are not struggling otherwise, that maybe even quite chubby. They might be sweating a lot, especially on the head, and they might have reflux, right? And Nux vomica is for that type of reflux where the baby has frequent spit-ups and is quite gassy and irritable. Nux vomica baby will be arching back, yeah, after feeding, the screaming and arching back. And Nux vomica is also good for babies who have the food sensitivities, right? So if you do the food diary and you identify some sensitivity, yes, try to avoid that food, but also try Nux vomica, it might help. Now here is the bit about the use of essential oils. So as I said, you always have to dilute the essential oil for babies, right? The general principle is about 20 milliliters of base oil, which is about 4 teaspoons, and only 1 drop of essential oil, right? So if you want to use more than 1 essential oil, let's say you want to use, I don't know, lavender and chamomile, for example, for something, it's best to either you have to use 40 milliliters, 8 teaspoons of base oil, and then put 1 drop of each, or you have to get like a spare little bottle, mix some lavender and some chamomile or whatever oils you want to use, mix the oils first, the essential oils first, and then put 1 drop of that mixture of essential oils into the 20 milliliters of the base oil. And the base oil can be, as we said at the beginning, something like shea butter, jojoba oil, not lavender, almond oil, coconut oil, olive oil, sunflower, grapeseed. There are myriads of basically plain vegetable oils, seed oils. Obviously, if there are any nut allergies in the family, be careful with nut oils. But other than that, should be fine. Similar principle goes for using the essential oils in the bath. Yeah, again, we said that you have to dilute the essential oil in something so that it then disperses in the water. So you can use salt, or you can use milk, you can even use breast milk. So if you're breastfeeding and you're leaking on the other side, you can be catching that milk into your haka or breast shell or something like that, and then use that milk to put in baby's bath. So again, you would need like 20 milliliters of the milk, or you can use general milk. So you can use 20 milliliters of that milk and 1 drop of essential oil, right? In terms of the salt, You can use either like Epsom salt, bath salt, or Himalayan salt, Celtic salt, or even just normal table salt. And maybe take like 4 tablespoons of salt and put a drop of essential oil in it. I mean teaspoons, not tablespoons, 4 teaspoons, and 1 drop of essential oil. And this is how you make the essential oil water. Remember I said like for the cleaning the skin, like if you have a nappy rash or something, you can use hydrolat, which you can buy, or you can make your own version of hydrolat. And the way to do it is you take about 250 milliliters of water, which is 1 cup roughly, and boil it. And then you put it in like a pot or some vessel that has a lid, and then put into the hot water 6 to 10 drops of essential oil or mixture of essential oils, cover it with a lid and let it cool, right? As the, it's hot, so as the steam is coming up, it is, what's the word? As it cools on the lid, what is the word? Condensates, yes, it condensates on the lid and drips back, right? So then when it's cold, you take the lid off and then you strain it. You pour it through unbleached paper coffee filter. That paper filter will catch up any residues of the oils. And what you're left with is just water infused with essential oil, basically. And that water you can use to clean the bum if there is like a nappy rash. You can use it to sponge the baby down if they have fever. Or even in summer, you can use it maybe for older babies, or even for yourself as like a little cooling spritz, something like that. So keep it in a jar, and it's better to store it in the fridge so that it doesn't catch any like mold or anything if it's on the counter. Right, that's the essential oil. And here are some books that you could consider for the natural remedies for your little ones. The first one is on aromatherapy, the middle one is herbs, and the last one is homeopathy focused. Okay, thank you. That's all. Hope you found it useful. And if you have any questions, as I said, put them under the video, or you can get in touch with me through my social media. All the best. Inshallah, everybody stays healthy and well. And I'll look forward to seeing you at one of my next workshops. Bye-bye. Assalamu alaikum.